Hi, my name is Dr. Ehsan Sadri. I'm board certified ophthalmologist here in Newport Beach, California. It's just wonderful to be here with you. The new year is here and everyone's asking me about Botox therapy. What is Botox? What is Dysport? What is Juvia? What are the products? Why do we use it? Well, as you know, as we all age, due to sun exposure, we can have changes in our skin, which is natural. And this type of changes occurs over time. And one of the things that I always tell patients is you don't have to be okay with that. You can actually fight against it if you want, and by using something called botulinum toxin, or better known as Botox. Botox actually was founded by an ophthalmologist in San Francisco, and this is kind of a funny backstory, but he was a pediatric or adult strabismus surgeon, which basically means he would fix people's eyeballs if they were crooked. And he noticed that there was patients that were not good candidates for surgery. They had misalignment of the eyeballs, but they're not really entirely misaligned. So they were too minor for surgery. So he thought, well, wait a minute, why don't I use a toxin to inject in the muscle? Maybe I can straighten out their eyes. And actually, believe it or not, that's what he did. He went through almost 30 different toxins until he got the last one. The very last one was the botulinum toxin he used. He failed at 29 other ones. So if you're an entrepreneur, if you're doing something and it's failing, remember Thomas Edison. It took him 9,900 times to create the light bulb. And this doctor is an ophthalmologist. It took him 29 tries. And he could have stopped, he could have failed, he didn't. He went on. And sure enough, on number 30th, what he noticed is not only were the eyes now no longer crooked, the wrinkles were gone. And he was just like shocked by this. So what he did was he immediately patented it. And then a few years later, Allergan purchased it from him. What's exciting about that product is now north of probably $5 billion a year product globally. It's a big product because it's repetitive, as you know. It's not forever. You do it every 3 months. A lot of patients are interested about it, and men and women. Half of my patients that do it are men. And the reason is because everyone wants to feel and look their best at all times. My motto is look and feel your best at all times. And I think men don't have makeup. So it's hard to hide the wrinkles, and if you're interested in that kind of thing, you should ask your doctor. Typically, the botulinum toxin is diluted with some sort of solution. We call it BSS, or balanced salt solution, and that's injected into the very, what we call superficial aspect of the skin and muscle, which is basically, as you know, the skin being very thin around the face, especially the eyes. It's the thinnest muscle of the body, and so it's injected into the skin, and with time, within about 2 weeks of onset, you'll see a reduction in the formation of the skin wrinkles. And there's many different types of botulinum toxins out there now. They have their merits, but the first one was the Botox therapy. Still probably the most used, about 80%, although now new competitors are coming in play. So it's kind of exciting. If you have any questions, you can always send me a note. As always, thank you for watching, and please don't forget to hit the like button and the subscribe button, and we're here for you. So I wish you a wonderful new year.